Most chronic elbow pain stems from a nerve irritation in the base of your neck and back of your shoulder. On this chart, the yellow lines depict nerves as they extend from your spine out into your periphery. Elbow pain tends to either center on the outside of the elbow or the inside of the elbow. This corresponds to irritation of either the ulnar or the radial nerve, which branched up in through the back of the shoulder into the brachial plexus and into the back of the neck. People tend to get chronic tension points in either their neck, muscles in their rotator cuff, the back of their shoulder, and their lat, as well as their tricep and their forearm. This relates partly to overuse, partly to poor use, and partly to nerve irritation. There are quite a number of long stringy muscles in your forearm. All the muscles that flex both your fingers and your wrist extend from your hand up to a common point on the bone on the inside of your elbow. Your bicep also extends from the front of your shoulder down into the front of your forearm. This can be responsible for pain on both the insides and outsides of your elbow. All the muscles that extend your fingers and your wrist attach from a common point on the bone on the outside of your elbow. Also, there is your tricep that extends from the back of your shoulder down into the back of your elbow. Most elbow pains tend to be classified as either tennis elbow or golfer's elbow, tennis being pain on the outside, golfer being pain on the inside, both being classified as tendinitis. But most people don't understand what tendinitis actually is. Tendons are the tough bit of tissue that attach muscles to bones, and tendinitis literally means inflammation of the tendon. This term can be misleading when it comes to elbow pain, because many people have pain that persists for months in the complete absence of swelling and inflammation. That is because tendinitis is not just an overuse injury. It happens when the muscles being used are in an irritable state due to a nerve irritation stemming from your neck and shoulder. When the nerves are irritated, it doesn't take much to overuse the muscles and tendons, resulting in inflammation and pain. If you rest the joint, the body will heal the inflammation, but the nerve irritation may persist, and thus the inflammation and pain will return as soon as you attempt to use your arm again. Muscles are comprised of a whole bunch of stringy tissue that can stretch and contract. The muscle should have a certain amount of resting tone in it. In other words, at rest it is slightly contracted, not flaccid or extremely tense. This is dictated by the input of the nerve. If the nerve is irritated as it extends from the spine or anywhere in the periphery, it will result in an altered signal getting to the muscle. This altered signal can create bands of tension in the muscle, which will strain the joint, the tendons, and likely create pain. Muscles are attached to bones on either side of a joint by tendons. Tendons are a tougher tissue that only stretch a small amount. When the muscle is in a banded state, the tendons will have to endure a lot more stress and strain when the joint is used, and the result is typically a tendinitis. Postural issues that create a lot of immobility in the upper back tend to lead to an extension hinge in the lower part of the neck. This causes the person to move far too much through the C5, 6, and 7 joints, which can irritate the nerve roots as they extend from the spine. It doesn't always have to create neck pain, but it can simply annoy the nerve and lower the threshold for what it takes to overuse it further down the chain. The C6 and 7 nerve roots are the electrical wiring for your lats, biceps, and triceps, as well as the muscles in your forearm. So if the neck is irritated, these muscles will hold tension. Postural imbalances and movement mechanics related to certain sports and jobs can also lead to tightness in these muscle groups. It is this combination of neck irritation and repeated movement patterns that can make elbow pain last indefinitely. That is why the neck and muscle irritation must be dealt with first, followed by postural correction. If you just treat the elbow pain, you are addressing the symptoms and not the root cause. If you put an acupuncture needle into a healthy, happy, normal muscle, not a lot happens. But if you put the same needle into a muscle that is knotted up due to nerve irritation, the stimulus will cause the muscle to contract, and you will feel a deep crampy ache. This cramp will trigger a reflexive relaxation of the muscle and thus take tension off the tendons and bones. For a more in-depth explanation of how IMS works, please watch the video titled, "What is IMS Acupuncture?" IMS can significantly calm down the nerve irritation and pain, and open a window for you to address your posture and movement problems that created the issue in the first place. The results of IMS can last quite a long time, but if you continue your faulty habits, you are likely to re-irritate the nerves, muscles, and tendons. Icing and resting the elbow alone won't work because it just addresses the symptoms, and attempting to stretch and strengthen the forearm muscles tends to be a waste of time. IMS alone will work better, but again won't be permanent because you can re-aggravate the nerves. So the best bet is a combination of rest and ice initially, then IMS acupuncture, and finally posture and movement awareness exercises.